be speaking on revitalizing our communities through historic preservation. Oregon, as you know, and Portland in particular, has a lot of wonderful historic buildings, so this should be very interesting. Now, some upcoming club activities. Next Wednesday, March 9th, there will be a special City Club performance of The Visit by Sojourn Theater, which is at Marshall High School, and it will be followed by a post-performance discussion with the cast and the artistic staff. The price is $12, and it's available through City Club offices. Then on Thursday evening, March 10th, we'll continue our post-Illahee lecture discussion, and the lecture will be Wednesday night, just preceding it. It will be by Lucy Lippard, and her topic is On Art and Place, Traveling to Here. And the post-Illahee discussion will be held at the City Club offices over here on 9th and Washington. This month, our book title for Citizens Read is entitled The Portland Edge. And if you'd like to purchase it, you can get it for $10 off the cover price. And the book club will meet again at the City Club space on March 31st. Should be very interesting. And we continue our membership drive. For those of you who have heard this before, you can plug your ears and go, nah, nah, nah. But for the people who may not have heard this, I'd like to mention that our new membership drive continues through June 3rd, which is our annual meeting date. And for those members who join in February and March, there is a very special Oregon memorabilia package put together by a very special, unique Oregon asset, Thomas Lauderdale of Pink Martini. So as you can imagine, it will be quite interesting. Among other things, there are autographed copies of the Pink Martini CDs, but he also is donating a vintage Viewmaster from the original Viewmaster with Oregon historic sites. So that's well worth joining, and I look forward to seeing your applications being waved in the air so staff can pick them up. Now, details on all of these events and all of the and you may join on the website. Everything is on the website at pdxcityclub.org. So I raced through these briefly, but you can satiate yourself with the details by going to the website. Also, we do have audio CDs and videotapes available, which I think might be particularly interesting for our friends, and you may want to refer them to the Portland CityNet television programs because they're repeated several times. I think the first is at 8 o'clock tonight on Channel 30. Now, I'd like to thank our sponsors this quarter because without them, our broadcasts would not be possible. They help subsidize this, and we appreciate it very much. They are this quarter Nike Incorporated, Portland General Electric, and Preston Gates and Ellis, LLP. So thank you to them. Now, on to our program. Thank you, sponsors. Now I get to introduce Ms. Marie Smith, who became the 21st president of AARP nearly a year ago in April of 2004. Prior to that, she served a 6-year term on the AARP Board of Directors, and she chaired the AARP's National Legislative Council and was a spokesman for AARP's Women's Initiative program. She has an insider's view of Social Security since she previously held several senior managerial positions with the Social Security Administration. She currently lives in Maui, although she's spending a lot of time in Washington, D.C., she tells me, where among many other offices, she was appointed by the governor of Hawaii as Commissioner on the Status of Women. She's received, as you might imagine, numerous citations and awards and was recently cited by Ebony Magazine as one of America's 100 most influential African American leaders. And she is listed in Who's Who in American Women. So please welcome Marie Smith.
Thank you for that great introduction. Coming from Hawaii, I really would be remiss if I did not greet you with a warm aloha. Oh, someone's been to Hawaii. Well, I am honored to have this opportunity to address this forum about what AARP sees as a serious threat to one of the most successful programs in our nation's history, Social Security. Social Security is the only guaranteed, inflation-proof, lifelong source of income that millions of workers, present and future, can count on. Here in Oregon, over 300,000 women and 240,000 plus men and 31,000 children rely on Social Security benefits. That represents 1 out of 5 people in your state. In fact, without Social Security, more than half of all elderly women in Oregon would be living in poverty. AARP believes we should not be talking about replacing the rock-solid guarantee of Social Security with a risky gamble. This week, the members of the United States Congress returned to Washington from their President's Day recess, during which many received an earful from their constituents about Social Security. AARP believes this would be an excellent time to put aside all the smoke blowing and the posturing and begin the serious debate on reforming Social Security. Ladies and gentlemen, a serious debate on Social Security reform will reveal no magic bullets, no free lunches, and no pots of gold at the end of the rainbow. Yet, in so many words, that is exactly what we've been hearing so far from the supporters of taking money out of Social Security to set up private accounts. They would have you believe that their private account scheme is the knight on the white horse who will ride into Washington and both save Social Security and offer today's younger people a much better yield on their payroll tax dollar than they would get under the present system. Ironically, it was Franklin Roosevelt who said in his radio address on Social Security's 3rd anniversary, quote, "In our efforts to provide security for all American people, let us not allow ourselves to be misled by those who advocate shortcuts to utopia or fantastic financial schemes. We believe that Social Security needs to be strengthened now for our children and our grandchildren. But the solution should not be worse than the problem. Unfortunately, private accounts that drain money out of Social Security clearly are a solution that is far worse than the problem. They would cut Social Security's guaranteed benefits substantially while passing a huge burden of debt on to the future generation. And to top it off, today's young people would be very unlikely to do as well with the combined yield from Social Security and their private account as they would do under Social Security if we simply reform the current system. Now, I know there are those among you who are saying to yourselves, but why wouldn't the yield be higher if the person invested wisely? That's a fair question. And the answer is, the opportunity for high yield we would see in a free investment market would not apply to these private accounts. Because to be anywhere close to being feasible, a private accounts plan of that magnitude, financed by money drained from a pay-as-you-go system that also pays current retirees must contain many limits and restrictions. While no one has yet released a detailed plan for private accounts, the White House has given several background briefings at which they have revealed some important details of what they envision. And from what we've seen and heard, their thinking is consistent with Plan 2 of the 3 possible reform plans released by the President's Commission to strengthen Social Security back in December 2001. There has been quite a bit of analysis done on this proposal. The White House has acknowledged that those who choose the private accounts will not have the freedom to invest their account money as they wish. The number of investment choices they will have will be very limited, along the lines of the present thrift savings plan offered to federal employees and their retirees. And they currently offer 5 funds. You'll note that it's the thrift savings plan and not the thrift investment plan. I'll be back to that later. Private account holders would not be permitted to have pre-retirement access to the money in their accounts. And when they retire, they would be required by law to use their account funds to purchase an annuity substantially enough to keep their income above the poverty level for the rest of their lives. For most retirees, this will claim the lion's share of their account money. And then, when they die, they could not leave that annuity money to their children. But with that said, the bottom line is still the potential yield. Many would choose to live with all the restrictions if the potential yield from their account plus their remaining Social Security benefit was going to be substantially higher than what they would get if they opted to stay in Social Security only. But that is not going to be the case. The White House has suggested that the limit they will be allowed to contribute in the first year would be set at $1,000 and then would rise by $100 each year. And since they would be using only a part of their payroll tax for their private account, the private account holder may think they will still receive a decent guaranteed Social Security benefit in addition to the yield from their account. But that is not going to happen either. The White House has acknowledged that they are likely to follow the proposal in the Commission's Plan 2, which would change the way Social Security benefits are calculated. And they would do this by replacing wage indexing formula with a price indexing formula. The result would be a substantial reduction in the guaranteed Social Security benefit that would increase over time. According to the Nonpartisan Congressional Budget Office, CBO, by the mid-2040s, the average guaranteed Social Security benefit could be 40% lower than it would be under current law. For example, the monthly benefit for the typical widow in Oregon would be only $498, down from $906 a month today. And those who choose the private account option would not be permitted to keep all of their already reduced Social Security benefit. For each dollar accumulated over the years and sitting in the retiree's private account, the money they would receive from Social Security would be reduced by at least 80 cents. This is sometimes referred to as the clawback. So how would a combined yield from the private account and the Social Security benefit under the likely new system compare with what today's young people are scheduled to receive under today's system? The CBO analyzed the President's Commission Plan 2 in detail and calculated the likely share of a worker's pre-retirement income that he or she would get under that plan. This is known as the replacement rate. They compared the results with the promised benefits under the present system. The results may surprise you. If a person retires between 2045 and 2055 and is among the highest fifth of earners, the present system will replace, on average, 23% of his or her pre-retirement earnings, while the private accounts plan will replace, on average, 16%. If a person is among the middle fifth of earners, the present system will replace 40% of their earnings, while the private accounts plan will replace 27%. And if they are among the lowest fifth of earners, the present system will replace 70% of their earnings, while the private accounts plan will replace 55%. For today's young workers, their private account yield would have to be much greater than average just to equal what they would be guaranteed under the current system. So, private accounts clearly won't help the future retirement security of today's younger workers. And as I have noted, private accounts that divert money from Social Security payroll obligations won't help Social Security's long-term financial security either. After all, benefits to current beneficiaries still must be paid, even though there will be less revenue due to the diversion of payroll taxes into private accounts. So, what happens? Extensive national borrowing would be required to meet these obligations, resulting in higher interest rates and additional interest payments. On top of that, the borrowing to fund an extended transition period could equal as much as $2 trillion over 10 years. At a time when deficit figures are already at record numbers, it makes no sense. It should come as no surprise to you that AARP has taken a position firmly opposed to private accounts that divert money from Social Security. But can the present system be salvaged? Of course it can. And now is the time to act and spread any cost over all generations rather than leaving it to our children and grandchildren to shoulder the load. Unlike health care in this country, Social Security does not need a radical overhaul. We don't have to dismantle this successful program in order to save it. Social Security today is not in crisis. It's not going broke. The trust fund will be large enough to pay 100% of promised benefits until the year 2042, when the youngest of the baby boomers will be 78 years old. After 2042, if no changes are made, fully 70% of promised benefits can still be paid. What we need to do now is to take steps to strengthen Social Security's long-term solvency to ensure that full benefits can be paid beyond 2042. So what is all this talk about the system going broke in 2018 and then 2028 is thrown up too? In recognition of what would happen when the post-World War II baby boom generation reached retirement age, excess payroll tax collections were legislated in the early 1980s. The intent was to create a surplus in Social Security Trust Fund designed to meet the nation's obligation to boomers when they retire. So for years, Social Security's trust fund income has exceeded its payout, and the trust fund has grown as it was intended. This will begin to change, however, in 2018, there's that date, when Social Security is projected to begin taking in less money than it pays out in monthly benefits. In 2028, the annual payout will begin to exceed annual income plus interest earnings, and the bonds that are currently in the trust fund and accumulating would need to start being redeemed. While you never like to take in less than you pay out, if you have the resources to cover the imbalances for another 24 years, that is hardly a crisis. Nevertheless, AARP is not satisfied with the status quo. We want to guarantee full Social Security benefits beyond 2042 for all future generations. But we believe there are sensible ways to ensure Social Security's long-term solvency. Once we put aside the non-starter of taking money out of Social Security to fund private accounts, we need to have an honest debate about the serious options available to us. Here are a couple of examples that combined would get us well over half the way toward solvency, and there are other possible options to consider also. But one would be you could restore the total wages tax by Social Security to 90% of nationwide earnings. This would move the current cap from $90,000 in 2005 to $140,000, perhaps spaced in over a decade. So what we're saying is the most that you will pay taxes today, FICA taxes, is on $90,000. If you're lucky enough to earn more than that, that is not subject to FICA taxes. And what we're saying, move that cap to $140,000. Another would be to diversify trust fund investments in a total market index fund, like most pension funds, to get a higher return. This could fix about 15% of the problem. And I didn't mention the previous one would fix about 43%. And there are other possible options to consider as well, a lot of them. Reasonable steps such as these, including possibly adjusting benefits, will be enough to strengthen Social Security for the long term. But taking money out of Social Security payroll taxes for private investment funds, let me say again, it would only worsen the solvency outlook rather than improve it, and could lead to large benefit cuts. That approach is risky, hugely expensive, and unnecessary. Strengthening Social Security is the cornerstone of providing economic security for future generations. But creating and protecting pensions and savings are also essential. Defined benefit pensions are being replaced by defined contribution plans like 401ks and IRAs. This shifts the investment risk to the individual. We have long championed improvements in these private accounts. But for a secure retirement, we need these savings in addition to Social Security, and definitely not at the program's expense. Increasing national savings is a proven way to grow the economy while lessening the burden on future generations. But the savings rate in America is abysmally low. People need to save more. And there are two steps we can take that are relatively simple. First, new employees joining companies with 401ks usually have to decide whether to join the plan. But if they were automatically enrolled and had to make a conscious decision to opt out, savings would increase dramatically, and we know this. The second way to increase savings is to provide an option for those receiving tax refunds to have all or a portion of it automatically deposited in the individual savings. According to the experts, these two steps alone could double the nation's savings rate and provide people with a much greater retirement income. All of this brings us back full circle to the federal government's thrift savings plan. It's precisely the model AARP would like to see. Social Security as the foundation, supplemented by a private pension and savings. And I know some people think that under those thrift plans, the thrift plan comes out of the Social Security benefits. That is not so. Everyone pays full Social Security benefits, taxes on all the dollars, and they take an additional amount out of pocket to pay for the thrift savings plan. And that is the model, in addition to, not instead of. We also need to explore bigger ideas, such as a universal plan that would require employers to make available to each worker the option of a 401k type retirement account. Chairman Bill Thomas of the House Ways and Means Committee and Chairman Jim McCrary of the Subcommittee on Social Security have both said they want to think about combined strategies to strengthen Social Security, increase national savings, and perhaps address the problem of long-term care. AARP stands ready to help. Some might say that I'm a bit old-fashioned, but I believe that our Social Security promise embodies our deepest values as Americans, our obligations to one another, our obligations between generations, between parents and children, between grandparents and grandchildren, between those in retirement and those at work, between the able-bodied and the disabled. The promise of Social Security has endured for 70 years. And I don't believe we should be putting an expiration date on it now. Social Security today supplies nearly half of the income for many older Americans. The percentages are even higher for minority populations. And for 1 out of every 3 beneficiaries, especially older women, Social Security is all that stands between them and living in poverty. We at AARP view it as a binding obligation to current and future generations of Americans to make sure their Social Security benefits will be there when they need them. We believe it is our responsibility to advocate for Social Security reform, not to dismantle the program. I will conclude by saying that AARP's opposition to private accounts funded by Social Security is not a liberal position, or a conservative position, or a Republican position, or a Democrat position. It's a common sense position that can and should be supported by people of all political persuasions and ideologies who care about the future retirement security of our children and our grandchildren. So let us join together now and begin the serious debate on the reform of Social Security. Thank you.
Well, that was rousing. I didn't see anyone nodding off. We come now to our question and answer period, and City Club members only have the privilege of asking questions. But our first question will be asked by our board host today, who is Susan Hammer. Susan has been a member of the club since 1981, and she is now a Portland attorney, mediator, and arbitrator, focusing on business and employment disputes. And she is a fellow in the International Academy of Mediators. Susan?
Well, thank you, Marie, and I'm delighted that you were scheduled to come see us this week. I'm not quite sure how that happened, but it's wonderful timing, and we sure appreciate you being here. My question is not about the changes that are proposed to the Social Security system, but about AARP. Historically, I haven't thought of AARP as being a particularly contrarian organization. And in recent weeks, you've grabbed a lot of headlines, I suppose in part by being taken on by the same group that supported the Swift Vote veterans. And I'm interested in what effect, if any, being in the headlines in this way has had on your organization. Has it increased your membership? Have you heard back from people that do or don't like what you're doing? And what can you tell us about your organization and the effect this has had on it?
I don't know whether to thank you for that question or not. We did notice the news about whatever the group is that's out there, but you know, AARP is focused on Social Security. Social Security is about real people. You heard some of the statistics I gave, that so many people, especially women, depend upon that check to survive. And so we do not feel we can move our focus off of the issue. You know, we have to keep our eye on the prize. And the prize is a solvent Social Security system. So basically what we've done is say what that group said about AARP is false. And we're going to move right on, keep our laser beam focused on this issue that is before us.
Paul Meyer, member of the club, and this is a follow-up question because last summer when the Swift Vote veterans attacked John Kerry, he sat back and did not respond. Will AARP let itself be smeared without responding?
As I said earlier, we are not going to get into a debate because that is exactly what would be expected, for you to use your resources, your time, your energy, your very best minds to mess around with something that's in the mud. You know, I was always told that if you get yourself caught in a bucket of mud, you don't jump up and down. It splashes all over everyone. It dirties you, and it dirties everyone within sight. What you do is stay still and just ease on out. And you take care of the business at hand. And AARP, we have Social Security, Medicare, Medicaid, monumental problems. Social Security may easily be the greatest debate of the century. And we're not going to change our focus. That's where we are. Yes, sir.
I want to thank you very much for Tom Cox, City Club member. Thank you for departing Hawaii to come to the Pacific Northwest and give us such an excellent speech. I agree that we need to have a very honest dialogue. I was sorry that you didn't take the opportunity to call for a change in the way we talk about the accounting of Social Security. That what's called the trust fund is not by any accepted accounting principles assets, that the accrued liability is currently off budget. And you say that private accounts are a risky gamble, but if the government invests in it in the same exact stocks, that is diversification. When your organization sells stocks, do you characterize them as a risky gamble? Or under what circumstances is stock investment acceptable to your organization?
Okay, number one, I think this is a wonderful opportunity for me to, I don't know if it was in that speech, I can't remember, but to say that AARP is not against savings and investments. We've never been. And what we do say is that we don't want to set up private accounts using Social Security monies that would weaken that system. But we have never said that. We're saying on top of it, just as the thrift plan that the federal employees now have, their retirees, they have a system where they paid into Social Security, they get monthly Social Security payments, and those who chose purchased into the thrift plan that was outside of, not a part of. And I think that's a key, difference that has to really be repeated. Thank you.
Hi, and thank you. I'm Bob Geary, club member. My question, I've only visited Hawaii, aloha. My question is about Social Security. For those of us who are cynical, and I'm a retired federal officer, what would you say, and I realize you speak for your organization, about the connection to Wall Street?
You mean that what would happen? Mm-hmm. Well, obviously, we don't have any thing that we've written out or that, but it's sort of obvious that someone has to handle these accounts. We're talking about millions of accounts. And that's where those $2 trillion, someone said, it can't cost $2 trillion. Well, you set up millions of accounts, and then what a lot of people have probably not thought about is the potential or probably the need for the establishment of a new bureaucracy to handle this whole system. So there are many things, that are going to be inherent in the system. I guess we can always say the devil is in the detail, see? And we don't have all the details. As I said, there is no actual plan out there. We're looking at the commissions, what they floated some years back as what could be a possible private account system. Yes, ma'am.
Elaine Cogan, we honor your proclivity not getting into the mud. However, would you share with us what the accusation is about your pro-gay agenda? I mean, can you at least tell us what they're talking about? What happened in Ohio?
Ohio had a bill before its state legislature, and it was about, I guess, people not cohabiting, living together, who were of the same sex. And I don't even know if it said the same sex. But what it turned out is that would have impacted, this legislation would have impacted our members. We have many members who live together who are of the same sex. You know, we don't want to put them in jeopardy. And so we're saying when you have legislation and the fallout is not what you intended it to be, then we cannot support it. And that's why, and we, you know, at the time, we never even thought that it could, you know, create this, but that's it. Yes. Oh, I'm on this side.
Elsa Porter, City Club member. I appreciate the depth of your arguments against the private accounts. And I also appreciated reading recently in the AARP magazine the beginning debate for the reform of Social Security. But what I see is missing, and I'm wondering whether it is on your agenda, is to look at the payroll tax itself. The payroll tax for 80% of American taxpayers is higher. It costs them more than income tax. And yet nobody, yes, so my question is AARP going to look at that as the elimination of the payroll tax and substitution of other, for example, energy consumption taxes as a way to reform Social Security?
That was a good question. Are there some alternative ways that we're looking at to finance Social Security? Currently, what we're doing, and our policy is moving us toward, and has been for 10 years, is to get Social Security solvent. And we know that some ideas are currently being floated about reforming the entire tax system. And there is talk of VAT tax, flat income tax. We do have policy on this where we have examined it over the years. And you know, what we really go for is we try and look at taxes that are progressive, not regressive. And we know that the FICA tax is progressive because it helps the people at the lower end of the economic scale. The return on the dollar, as I mentioned in the talk, is much higher, like 70% for the lowest quartile of Social Security beneficiaries. But these are all valid issues to look at. We need a couple more 24 hours in the day so that we can all get our arms around what's going on. But thank you again.
Thank you. My name is Jerry Marsick. I'm a City Club member. You know, help me understand this, because you said that, you know, one of the things that AARP is interested in is making the system more solvent, and you mentioned a couple items. One of them is increasing the limit to which Social Security taxes are taken out. That's fine. But you also mentioned taking Social Security tax money and investing it in index funds. Now, index funds go up and they go down.
Yes.
Now, in the state of Oregon, we've had a terrible time. How do you address that? That sounds like a risk to me.
It is a risk, but the risk is spread out over a very large group, namely the population of the United States, as opposed to the risk for individual accounts. You are left, if your choices are bad, you sink or swim there. If you invest to receive additional interest, then the risk is spread out over everyone who's involved in that system.
So under your plan, if the index funds went down, everyone would suffer. Is that right?
Okay. Oh, well, it's a whole question that comes up. How can you support, investments that might have some risk? But we would hope that the risk would be minimal, but they would bring in additional revenues. You know, maybe currently the bonds that we invest in, you get approximately 6% was last year. Prior to that, it was 4%. So it's ranged 4-6%. if you go in and could get an extra percentage or 2% on a part of the excess funds that are in the trust funds, then you could generate more revenue, and we figure bring in about 12%. But it's not something that we don't have a plan. We're saying these are possibilities. Like there's a possibility you could raise the age at which you receive Social Security. You could change the formula upon which you figure Social Security benefits. We know there are about 25 different ways. And whomever, that would be up to Congress, who would come through with these, you'd have to figure it out to get the 100% that would be needed to shore up Social Security. But there are many ways to do this. I was talking to a group out at the community college, and I said we could, I could get my Diet Pepsi and they could get their whatever they drink. We get us a couple of pizzas, go in a room, close the door, and we could come up with a solution. Might not please everybody, but the solutions are there.
Aloha, I'm Mike Radway, City Club and AARP member. Thank you for bringing sunshine with you from Maui. We're not used to it up here at this time of the year. In Oregon, our junior senator is chairman of the Senate Aging Committee and also a member of the Senate Finance Committee, and therefore in a position to have an important role in the future of this issue. Have you had any discussions with him on this topic, and do you know where he is on private accounts?
I didn't hear the first name.
Senator Smith.
Senator Smith, I have not, but I know our state people who are here in Oregon. AARP has a state office. They have been in discussion with all of the leaders, so we're happy that we're on board. As I understand, most of your congressional leadership have not committed, and so we are in touch and talking.
Hi, Will Clark, City Club member, and I work as a pension actuary. The most recent annual reports from the trustees of the Social Security Trust Fund and the Medicare Hospital Insurance Trust Fund make the point that the financial problems facing Medicare are actually much more immediate and in the long run much more severe than the problems facing Social Security. In the current political climate, that's not screamingly obvious, I don't think, to the average U.S. voter. So what is the AARP doing to communicate that situation to its constituency, and what does it advocate to address those problems?
Okay, that was a very good question, and I don't know. I'm starting to see it in some of the newspaper articles now, that the reality is that the Medicare financially is in far worse shape than Social Security. But we have to face the reality is that the president raised Social Security to the highest level. So that's where we're functioning now. But we do have policy, and our priorities for this year, 2005, Social Security, Medicare, Medicaid. And we have principles upon which we base almost everything, because you don't know. One plan might have 4 or 5 items in it, another might have none. But we have set about over the years to develop a set of principles on health insurance, health care, and that would of course include Medicare. And we know the system is in trouble, and we will be there when it's raised by the Congress to testify, to bring all the information that we have accumulated over the years so that it can be a part of the dialogue too. But we're not just talking about Medicare, I don't believe. I think we're talking about the whole health care system. So this is a big, big problem to tackle.
Well, I enjoyed your talk, and I certainly share your opinion about the investment accounts. Well, you mentioned briefly the difference between the wage-based and the cost of living based, and clearly that makes a big difference. There's no doubt about it.
About 40%.
On the other hand, I think it could be argued that to have a wage-based is irrational. Now, would you, at least could be argued, what position would the AARP take? I can see 2 possibilities. One is you don't want anything lowered, and the other is you'll really engage in this question. What would you, how do you say?
Well, what we want, we're still looking at it, but our analysis is that the proposed change is really draconian. You know, to slash benefits by 40% really is, without an extremely good reason. And we feel that the current system is more in keeping with trying to provide a partial replacement of income lost on account of retirement. And so the new one, obviously, when you make that kind of a cut, it impacts people tremendously. And we're talking about some people are, they're well off, they're going to do okay. But the majority of the people in this country who receive Social Security benefits, they rely on it for upwards of 40 to 50% of their retirement income. They cannot afford to have it cut. So that's where we are. We're trying to look, how do you keep something? And we know that Social Security was never meant to totally replace lost income on account of retirement or disability or death. But it was to give a strong basis for the rest of that income.
Hi, Chris Wu, City Club member. Thanks for being here today. I guess my question mostly is sort of a philosophical one, as I think most people my age, the 30 and under crowd, sort of doubt that our retirement will happen at 65. It will probably be pushed back at some point between now and that period. Does the AARP feel that Social Security is something that should enable people to retire at 65 and enjoy a non-working retirement, or should it be something that down the road would be part of a working retirement as our population's life expectancy ages and so on?
Okay. That's an interesting question. I don't know if we really put it into so many words exactly like this, but we know from our studies, we've talked to all kinds of people your age who have no intention of retiring the way their parents and grandparents retired. You hit a certain point, that's it. You go to the golf range or play bridge or whatever you do when you retire. We know that's not going to happen. And so we have what we call the 4 pillars of retirement security income. And one of those would be work. Some people will have to work, and I don't expect it to be full-time kinds of work. It would probably be part-time jobs, entrepreneurial. Everyone wants to be an entrepreneur. Some kind of work, and then health insurance is a part of that. Because you can have as much money, you can have a lot of money put aside for your retirement. But if you have a major illness, you're going to spend down a lot of that. So we think that health insurance has to be a part of that, and then the traditional Social Security and the traditional savings and investments would take up. Thank you.
Kurt Wavering, member.
Hello, Kurt.
Appropriately, you've talked about Social Security as retirement income for older people, but it also provides social insurance for individuals and families where there's disability. And I wonder if you could speak to that, particularly the concept that when a disaster strikes an individual or a family, that it's the whole community that's responsible.
God, I didn't plant him here. But it's perfect because it's one of the areas we did not touch on. I appreciate your question. Social Security is a family benefit. We've been talking in this debate mainly about retirement, but there are benefits available for the dependents of people who worked and have a disability or should die. Those are valuable benefits worth many, many hundreds of thousands of dollars if you could find a policy on the market to cover it. So where does it stand in the current debate about private accounts? It's not another one of those devil in the details. We do not know what happens to those valuable family benefits. But you may believe that AARP will be there to make sure that there is an accounting on those programs. Thank you very much.
Well, thank you so much. Thank you so much. We all know that information is power, and I think we're leaving here a lot more powerful. Thanks so much to Marie from AARP. Thank you.